Hi, everyone. My name is Aiden DeCero, and I'm a public health nurse on the Healthy Schools team at Southwestern Public Health. And I'm recording this video as a representative of the Oxford and Elgin St. Thomas Planet Youth Coalitions to talk to you about the Planet Youth survey we're going to be doing with grade 9 and 10 students late this fall. My objectives for this short video are on the screen here. I'll provide an overview of the Planet Youth model, why it's important and effective, how it's done, and how we're going to do it in our community. Before I get into an overview of Planet Youth, this is a central metaphor to the model that's often used to describe its methodology. This image for the metaphor comes from LDCSB's Wellness Wednesday post archive. The central metaphor is that when a flower doesn't bloom, you fix the environment in which it grows, not the flower. The idea with Planet Youth is that we're addressing youth behavior through a survey and then changing the environments where they're growing so that they can reach their fullest potentials academically, in life, and in health. Planet Youth is based on the Icelandic substance use prevention model, which has been effective in reducing substance use and enhancing youth well-being in Iceland for over 20 years. Planet Youth has helped communities worldwide implement this model to build healthy environments for youth development. The model shifts focus of prevention from individual decision-making to enhancing the environments around youth. It uses local data to create long-term strategies to increase protective factors and reduce risk factors for substance use. In order to do that, there's a survey component and, hopefully, regular data collection and review cycles so we know what's going on, can intervene, and see if what we've done has changed anything. I find it's easier to understand protective and risk factors through an example. Luckily, the BBC did a report on Iceland back in 2018 that I think does a good job of summarizing the approach. They're going to talk about a curfew that some parent communities chose to impose. I'm not suggesting that that is a solution that would work here, but it is a good example of how a few parents can make a big difference to the community based on the data from this survey.
It was a huge problem 20 years ago, a huge problem.
In 20 years, Reykjavik went from being worse in Europe when it came to youth drinking, smoking and use of drugs to being the best. And that's kind of incredible, isn't it?
We are getting ready for a walk around the neighborhood to see if we have some kids wandering about that should be home already because it's after 10 o'clock. They are under age to be out after 10 and we told them if you find kids usually it's like that. They will just go home. But these were not drinking, they were just out. That's a different from the old days.
We try to be at home around 4, 5 the latest, and we try to be together until they go to bed at around 8. We are more, I think, today protective of childhood than we were.
And I think also in the old days there was more liberty and people were not as aware of the risks and dangers as people tend to be today.
But we are a boring country.
We train about 5 or 6 times a week, just after school, usually around 5:30.
We like to go swimming. We try to do that every day.
I often go with my brother to play volleyball.
The girls also play football, and also horse riding is very popular.
We measure different aspects of their lives, their relations to peers and family, substance use and how they feel. We create a report for each community, and within 2 months of the survey, each school has the findings so that they can figure what do we need to do in order to create the best circumstances for the kids in our community.
First, you have to decide to build what you do on evidence and research. Secondly, you have to fund it and get people out there talking to the parents, talking to the schools, talking to the youth clubs, and everyone that has to be involved.
Let's keep in mind, kids, they don't want to use drugs. They want to be able to lead happy, healthy lives.
We probably beat England in the European finals because of this program.
This is the graph that illustrates the successes we've been talking about in Iceland. Over 20 years, Iceland reduced drinking rates in 10th grade students from 42% in 1997 to just 6% in 2018. The smoking rate declined from 23% to 2%. This means that Iceland saw a 7x reduction in alcohol use rates and a nearly 10x reduction in smoking rates. Fast forward to today, as you can see on this graph, Iceland still tops the European table for the cleanest living teens. The graph demonstrates their continued success in keeping substance use trends for 15 to 16-year-olds under 10% for over a decade. As of now, this approach has been implemented in hundreds of communities worldwide with favorable results in decreasing substance use. In Canada, the model is currently being implemented all over. One in Calgary, it's the official approach to substance use in the province of New Brunswick, and it is in Temiskaming and Lanark County here in Ontario, along with many other communities across Canada coming online soon due to some federal dollars from the Public Health Agency of Canada. So how do we follow suit? First, we need better data. The Planet Youth Survey asks questions about the decisions students make and the things they choose to do at home, at school, and in their communities. The survey also covers the factors that influence those decisions. For example, does taking part in extracurricular activity actually mean that teenagers are more or less likely to have been drunk recently? The answer to that question is most often that they are less likely to have been drunk recently, but answers can differ based on students, community, and culture. So we collect data, analyze it, and find out. Then folks from the community come together to set priorities based on the data and commit to working out ways to create more opportunities for youth to thrive. If we know what's affecting teens in their social and physical and mental environments, we can work on solutions to modify and make those environments better. We analyze the flower and its soil conditions, and we change the fertilizer and watering plans. Let's look at our local rates in comparison to Iceland's data trend and see how far we can go and why we should start moving on this now. I've changed the orange line on the slide to Vape Daily since it's much more relevant to today's contexts. 24% of our youth reported that they drank enough to feel drunk in the past 4 weeks. 14% vape daily, and 14% have used cannabis in their lifetime. As you can see, we're where Iceland was back in the late 1990s and early 2000s. So what does this mean for you and your school? Well, there's going to be a student survey for grade 9s and 10s, and it's going to identify risk and protective factors like we talked about earlier. It's entirely voluntary, it's anonymous and confidential, and it requires active parent and guardian consent, and it should take anywhere from 20 to 40 minutes. On top of that, the local Planet Youth coalitions will be working hard in the background these next few weeks to drum up enthusiasm in the community. Let's go over the key milestones between now and survey day. On October 20th, information letters and consent forms will be sent to parents via school messenger. For Thames Valley schools, these forms will also be available on the parent portal. All forms are to be completed and submitted online before November 10th. Between October 20th and November 21st, our school team will be working at your school on raising awareness for the survey and increasing participation. This could include wellness cafes, leadership class projects, or any other grassroots initiative students find engaging. We want promotion to be as student-led and community-driven as is possible because we believe in the importance of this survey and know that the right nudge can make a big difference. We ask all teachers to encourage their grade 9-10 students to participate in this important survey where possible. If you're a leadership teacher, promotion of this survey may be a great opportunity to get students involved. We have a leadership class promotion group project outline we can share to get you started. You may notice some awareness activities will continue beyond the November 9th consent deadline. This is intentional. We want students to be excited and motivated to participate on survey day, even after they've submitted their consents. From November 10th to the 21st, we'll be working behind the scenes on survey logistics. The survey itself will be administered between November 24th and December the 5th. Finally, our goal is to accomplish high standards of data collection and reporting. To achieve this, we need the most amount of students to complete the survey as possible. The more student respondents who complete the survey, the more details we can provide in school level and community level reports. Thank you so much for watching. If you have any questions, a member of the Southwestern Public Health Support Team is available to answer them, or you can email me at the address on the screen.